Hi, I'm Lisa Schaefer, Executive Director for the County Commissioners Association of Pennsylvania. May is Mental Health Awareness Month, and Friday, May 19th, is Mental Health Action Day. As the key coordinators and providers of mental health services in the Commonwealth, counties know that it is time to take action to build a mental health system that fully supports Pennsylvania's needs. For too long, we've lacked the resources to be there for our residents. When the governor proposed $20 million for the county mental health base, counties called it a down payment on needed investments in the system. But think about how a loan works when you need funding to help make a large purchase. The more you invest up front, the less you ultimately pay overall. The principle is the same here. Our mental health system is suffering from more than a decade of underfunding, and if we don't make a significant investment up front this year, we will continue to pay more and increase costs to our healthcare and correction systems. We will continue to see poor outcomes for Pennsylvanians and wonder why nothing is changing from the crisis we see in front of us. And the more you invest up front, the more equity you build for yourself. That's what a significant investment in the county mental health base this year can do. It can show our commitment to rebuilding equity in our crumbling mental health system, with that investment coming directly back to Pennsylvanians over the long term. Governor Shapiro has put an additional $120 million on the table for mental health services as part of his budget proposal. Counties believe if we can increase that to $150 million and invest that in the county mental health base, we can truly start to move toward building a community system that will fully meet Pennsylvania's mental health needs in the long term. At the same time, we need to finally allocate the $100 million in federal American Rescue Plan dollars that has been set aside for mental health to help stabilize our mental health infrastructure. With the coordination counties provide, we can break down the silos and the barriers instead of putting them up by investing in only some of our mental health needs. We can build the infrastructure for a strong system that meets Pennsylvanians where they are: children, teens, young adults, seniors, families, and communities. Pennsylvania residents have waited long enough while the impacts of at least 15 years of underfunding have unraveled the mental health system to the point of collapse. At this point, more than $1 billion in additional investments are now needed to fully support the community mental health system. Rebuilding this system will not happen overnight, but the time to act, and to act boldly, is now.